Hello, my name is Rosalind and I'll be performing NG gastric tubing, insertion, and removal for NR224. With that being said, let's get started. I have viewed the patient's medical history for any nasal problems such as aspiration, facial, sinus, and oral surgery, any anticoagulant therapy, any chronic sinus infection, and any nasal polyps. With that being said, let's get started. Knock, knock. Hello, my name is Roslyn. I'll be a nurse today. May I see your wristband? Patient show me their wristband. May you please provide me with your full name and date of birth? Patient provided me with their full name and date of birth. I have viewed and verified doctor's orders. The doctor's orders and the doctor ordered nasogastric tubing insertion and removal. Do I have your consent? Patient said yes. So I provide privacy, put my item on a clean surface, and perform hand hygienes. The nasogastric tubing will be inserted due to the fact that it's noticed that you are having difficulties when it comes to eating properly. The nasogastric tubing will aid in preventing any aspiration from occurring and provide adequate nutrition. It will be inserted through the nose, going all the way down to the stomach. During the whole duration of the nasogastric tubing, you'll be placed in a high fibrous position, and upon removal, you may feel slight discomfort. Do I have your consent to continue? Patient said yes. Do you have any questions before we start? Patient says no. With that being said, I will give you a set of instruction, which is requesting your participation. With that being said, we'll just get started. Is now a good time? Patient says yes. Are you feeling nauseated? Patient says no. Do you feel like you're about to vomit or have you vomited? Patient says no. On the scale from 0 to 10, 0 being no pain and 10 being the worst, what is your current pain level? Patient says 0. So what I do, I place garbage within reach, bed and hip level, patient in a high phallus position, perform more hand hygiene, take tape 3 inches. I'm not going to use literally 3 inches. I need my tape. And put it on the edge of the table by the bed. Or if we have a mail stand, I'll use a mail stand instead. I'll do about 4 of them like this. The 4th one, I will tear about midway through and place on the edge of the table by bedside as well. Then I will open up my nasogastric tubing and my container for the nasogastric tubing. Take my lubricant and spray. Perform more hand hygienes. Don on clean glove. Take my pen light. I will assess for any obstruction, any polyp, any irritation of the mucosa, and any septical defect. Checking the inner nostrils, and there's none present. I will confirm for any trauma, surgery, or any nasal bleeding if any had occurred. Patient stated no. Then I will ask the patient to occlude the left nostril, breathe in and out. Do the same for the right nostril, breathe in and out. Patency is intact. Take my tongue blade, assess gag reflex. Gag reflex is intact. I'll dispose. Then stethoscope, check, assess for lung sounds and bowel sound. Warm up. Is it okay if I lift your gown to assess your lungs? Patient says yes. Upper right clavicle, upper left clavicle, lower left clavicle, lower right clavicle, and so forth. Now I'll be assessing bowel sound, lower right quadrant, upper right quadrant, upper left quadrant, lower left quadrant. Lung sounds is bilaterally clear, and bowel sound sounds great. I now will take my tubing. Let's dispose of this. Take the tip of my tube and measure it to the tip of the patient's nose, all the way to the tip of the patient's ear, and move downward to the zygoid process. It meets here. I'll mark it with a marker or simply take one of my tapes and mark it. Let's coil it on non-dominant hand. Take a towel and place it over the patient's chest, protective barrier. Lubricate about 4 inches of the tube. Take a cup of water with straw, including basin, just in case of the patient's need to vomit, and specify to patient if you need to vomit, please vomit in basin, and also please raise your hand if you need me to stop. In the same token, I'm gonna need you to drink the water, take gulps while I insert the tubing. Patient gave me the okay. Now with that being said, let's get started. I insert, then stop, and ask patient to have the chin to touch their chest. Then insert some more and tell the patient start gulping while inserting. Let's act like this is, there we go. And swallow, 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 swallow. It had met the marking, or it had came to a resistance. Take my second strip that's cut midway through, while I'll secure one with one hand and tape it with the other. Now it's secure. Take my 60cc syringe, remove the spigot. Let's just place that over here and leave that there. Let's take this. I'll move the gown. I need to check your lung sound. Let's put this in the dirty linen. I'll be lifting the gown now to check your lungs. Upper right clavicle, upper left clavicle, lower left clavicle, lower right clavicle, and so forth. Lung sounds is clear bilaterally. Take my other piece of tape and place it onto patient's nostrils, and then using my container, I will start extracting gastric contact. Start removing, kink it up, put spigot back in so no air come in, put it in container. Repeat the step, remove spigot, uncoil, withdraw gastric contact, then kink it back up, put spigot back in. Put gastric content in container. One more time. Remove spigot. Put 60 cc in. Uncoil. But don't take as much. Just enough for our medicine cup. Coil it. Remove 60 cc. And put your spigot back in. Place gastric content into empty medicine cup. Take my strip. Dip it into the gastric content. Measure it, which is 5. The pH is 5. And it's within normal limits. Take my gastric content back. This is the gastric content that I'll withdraw from you. We'll be replacing it back. It have all the nutrient and enzymes that is needed. Remove my coil it. Remove my spigot and gently insert it back into the tubing. Let's put it back in. Alright. And then I inform patient that an x-ray will be done to confirm that the tubing is in the correct place. Take my 4th piece of tape, place it onto gown to secure it. Place the towel right here in case it drips, and we have to leave it above the GI. Then I lower the patient, lock to make sure the bed is locked, car light is in reach, and leave the patient in a high fireless position and inform the patient, thank you for being a great patient. Take all of my supplies that was used, place it into trash. I'll pour this down the biohazard or anything like that. All this into trash. Remove my gloves. Perform hand hygiene. I thank you again. Now I'll be doing the removal of tubing. I knocked, patient allowed me in. I assessed the patient's ID bracelet to identifier, and I viewed and verified doctor's order and informed the patient of while we removing the tubing, and the patient gave me their consent. Now I perform hand hygienes. I have put the trash within reach, bed and hip level, and the patient's already in the hip high fireless position. Perform some more hand hygienes and put the railing down. Done on gloves. Since the patient gave me their consent, now we are going to be removing the tubing. I untape, remove the tape. Act like I removed the tape from the nostril. There we go. Remove the tape. While security holding this in place. Remove the tape from gown while securely still holding this in place. I'll provide the patient with the towel that's here or the towel that's provide like a napkin, and give them a basin. Let them know if they need me to stop. Let me know just by raising their hands. Do not speak. And they need to vomit. Just raise their hand and I'll stop, and here's the basin to vomit. So with that being said, I need you to hold your breath while I withdraw the tubing. So let's go. So hold your breath. I gently withdraw, withdraw, hold your breath, hold your breath, hold your breath. Now it's all the way out. You may breathe. I assess the tubing for to make sure that it's intact, which is intact. Dispose everything. Take the basin, towel, put in dirty linen. Are you okay? The patient says yes. I provide the call light again. Make sure the patient is comfortable. Lower the bed again. Make sure it's in locking position. Put the railing back up. I remove my gown. Perform hand hygiene. Are you okay? The patient says yes. I'll leave the patient in the high filer position if they want, or lower the bed if they like, if the doctor permits. With that being said, I am done.